Smartphones are killing the human race. Well, not really, but some of the repetitive hand motions that we do with our phones, like texting, swiping up and down, tapping, pinching, and holding on to them, can be very irritating and painful to our nerves and tendons in our wrists. Today I'm going to talk about a condition that's called smartphone-induced carpal tunnel and tenosynovitis. If you suffer from pain at the base of your thumb, on the palm side, or along the back of your forearm, then this video is for you. Make sure to watch till the end so you don't miss out on any home remedies. And of course, if you like it, give it a thumbs up. Smartphones have become such a part of our daily life. We use them not only for communicating, but also for everything else like banking, shopping, browsing the internet, reading news, and posting stories. However, according to medical expert, too much using smartphones has been linked to various health problems like triggering and worsening the symptoms of carpal tunnel syndrome and tenosynovitis. Now, what's carpal tunnel syndrome? It's a condition where the main nerve to the thumb and the first two fingers, which is called the median nerve, gets compressed or squeezed as it travels through a narrow passageway in our wrist bones called the carpal tunnel. And the result is usually pain, numbness or tingling in the thumb, index finger, middle finger, and sometimes the half of the ring finger. And what's tenosynovitis? Tendinitis is an inflammation of a tendon. The tendons are the strong, fibrous tissues that connect muscles to bones. The most common form of tendinitis in the hand is called de Quervain's tenosynovitis. It's an inflammation of one of the tendons on the back of the forearm that helps with wrist extension against the pull of gravity, like when you lift your wrist up to pour a cup of tea into a cup. Now let's discuss how the overuse of smartphones can trigger or worsen the symptoms of carpal tunnel syndrome and tenosynovitis. First, let's talk about the structure of our hands and wrists. We have 27 bones in each hand that form a complex arrangement of joints that allow us to perform intricate tasks. Our fingers are connected to our bones by tendons, and these tendons are controlled by muscles located in our forearm. When we move our fingers, especially when we pinch things, we actually move our wrists backwards and forwards. This movement causes irritation to the median nerve as it passes through the carpal tunnel. Over time, this irritation causes the symptoms of carpal tunnel syndrome. Secondly, the tendons on the back of our forearms, including the extensor carpi radialis brevis, longus, and abductor pollicis longus, run behind the lateral aspect of our wrist. As we extend and bend our wrist to grip a phone, we put pressure on these tendons, causing micro tears in the tendon fibers. This constant stress can lead to tenosynovitis. So now that you know how it happens, let's discuss the symptoms. The symptoms of smartphone-induced carpal tunnel syndrome are pain, numbness, and tingling in the thumb, index finger, middle finger, and sometimes the half of the ring finger. This happens because the median nerve that supplies sensation to these fingers is being compressed. Symptoms of smartphone-induced tendinitis include pain on the back of the forearm near the elbow, especially when bending or extending the wrist. You may also feel swelling or tenderness in the affected area and weakness in gripping objects. So how do you know whether your pain is due to carpal tunnel syndrome or tenosynovitis? Well, that's not always easy to distinguish clinically, but here are some clues. If your pain is mainly on the palm side of your wrist or radiating into your thumb, then it's more likely to be carpal tunnel syndrome. If the pain is on the back of your forearm or when you extend your wrist, then it's more likely to be tenosynovitis. So who is at risk of developing smartphone-induced carpal tunnel and tenosynovitis? People who work in high-stress environments and do lots of repetitive hand movements are at the highest risk, including cashiers, factory workers, and musicians. Some studies suggest that women are more likely to develop these conditions than men. Now that you know all this, the next question is, how do you diagnose it? Smartphone-induced carpal tunnel and tenosynovitis are usually diagnosed based on your symptoms and a physical examination. Your doctor will ask you about your symptoms and the activities that trigger them. They will also check your reflexes and test your muscle strength to see if there's any weakness. Some simple tests for carpal tunnel syndrome include the Phelan's test and the Tinel sign. For tenosynovitis, they might perform the Finkelstein test. Now, what are the treatment options? The treatment usually includes a combination of rest, ice, anti-inflammatory medications like ibuprofen, wearing a wrist brace at night, physical therapy, and corticosteroid injections. Surgery is rarely needed. Let's take a look at some home remedies that you can try yourself. First, take frequent breaks. Taking regular breaks while using your phone can help reduce strain on your wrist. Set an alarm on your phone to remind you to take a break every half an hour. Stretch your wrists and fingers during these breaks. Move your wrist in circular motions or extend and flex your fingers. These exercises can improve blood flow to the area and reduce inflammation. Next, ice pack. Apply ice to the affected area for 15 minutes at a time, several times a day to reduce inflammation and pain. You can use a cold pack or wrap ice cubes in a towel. Third, anti-inflammatory medication. Over-the-counter anti-inflammatory drugs like ibuprofen can help reduce pain and inflammation. Follow the instructions on the label and don't take more than recommended. Fourth, wrist brace. Wearing a wrist brace or splint at night can help reduce strain on your wrist while you sleep. Make sure to choose a brace that is specifically designed for carpal tunnel syndrome or tenosynovitis. Fifth, posture. Maintaining good posture while using your phone can help reduce strain on your wrist. Sit up straight, keep your shoulders relaxed, and avoid hunching over your phone. You can also try using a phone stand to raise the phone to eye level to avoid looking down at your phone for long periods of time. Sixth, typing technique. The way you type on your phone can also contribute to carpal tunnel and tenosynovitis. Try to avoid typing with just your thumbs. Instead, use your entire hand to type. Also, try not to tap too fast. Give yourself enough time to type each letter. Seventh, exercise. Regular low-impact exercises like walking, swimming, and cycling can help improve blood circulation and reduce inflammation. Stretching exercises for your wrists and fingers can also be helpful. A good one is to extend your arm fully and grab your fingers with your opposite hand and gently pull your fingers towards you. Hold for 10 seconds and repeat 3 times on each hand. Another one is to extend your arm and grab your fingers with your opposite hand and gently bend your wrist up and down. Hold for 10 seconds and repeat 3 times on each hand. Eighth, consider alternatives. If your job requires you to use a computer and phone for long periods of time, consider using voice recognition software or other assistive technologies to reduce strain on your wrist. Ninth, see a doctor. If your symptoms are severe or don't improve with home treatment, see a doctor. They can perform tests to determine the underlying cause of your pain and recommend further treatment options like physical therapy or corticosteroid injections. In conclusion, while smartphones are incredibly useful devices, it's important to be aware of the potential risks to our health. By understanding how smartphone usage can trigger carpal tunnel and tenosynovitis, we can take steps to protect ourselves from these conditions. So, take regular breaks, maintain good posture, stretch regularly, and consider alternative devices if needed. Remember, knowledge is power, and taking care of your body is in your hands. If you enjoyed this video, please give it a thumbs up and share it with your friends. Don't forget to subscribe for more informative content on hand, wrist, and elbow conditions. Stay healthy and take care.